Good morning, everyone. I'll be presenting a case on recurrent cystoid macular edema. So, a 37-year-old male presented to us with recurrent episodes of pain, blurring of vision and redness, and photophobia in the left eye since 8 months. There was no history of any floaters, fever, joint pain, back pain, history of any trauma or any similar complaints in the past. Patient gave a vague history of any intermittent skin lesions and oral and genital ulcers in the past, which were treated on its own. So his symptoms started 8 months back when he consulted a local ophthalmologist, where he diagnosed as a uveitis and was treated with topical steroids. But after stopping of the steroids, there was recurrence of symptoms. So the patient visited another ophthalmologist. Due to the recurrent uveitis, he underwent VDRL, TPHA, and pathology test, which were negative. And so the patient was treated with topical and systemic steroids, but even after that there was not much improvement. So there was a recurrence of uveitis, and he consulted a third ophthalmologist, where MON2, ANA, rheumatoid factor, and CRP was done, which was found to be negative. But at this visit, toxo, IgG, and IgM was found to be positive. So the patient was treated as toxo and with the Bactrim, azithromycin, and systemic steroids. And with this, there was some improvement, but eventually, after decreasing the dose of the steroids, there was again a recurrence. So the patient finally landed with us. So when he landed, the vision in the right eye was 6.6 and 6. In the left eye, it was 6.18 and 10. And there was right eye examination was normal, whereas left eye showed some cells and fine KPs, and the intraocular pressure was normal, and the fundus shows only macular edema, and rest of the fundus was normal. So this is the OCT. Right eye OCT is normal, whereas left eye is showing some cystoids in the So the patient was treated with steroids, and the patient was reviewed after 2 weeks. There was improvement in the vision from 6.18 to 6.9. The uveitis has reduced, and the macular and OCT was done, which shows there is improvement in the cystoid macular edema in the left eye as well. So we had asked the patient to review after 1 month, but the patient had a COVID infection, so he landed up after 2 months. There was drop in the vision again in the left eye to 6.18. There was recurrence of the uveitis, and this was the fundus photo at that moment. Only there is presence of cystoid macular edema in the left eye. There was no features of any intermediate or posterior uveitis at this moment. We went ahead and did an OCT. There was recurrence of the cystoid macular edema, but at this time there was an SMD. So due to the presence of recurrence of cystoid macular edema, we underwent and did an DFA. DFA right eye was normal. In the left eye, it showed the hyperfluorescence of the disc along with the vessel staining and the typical flower petal appearance of the cystoid macular edema. And in the periphery, there was a capillary leakage. So at this moment, we were suspecting a small vessel vasculitis, and with the history of genital and oral ulcers, we went ahead and sent the patient to the rheumatologist for with a suspicion of Behçet's disease, and the patient was treated with prednisolone and hometropine in the left eye. The patients underwent battery of tests, which all were negative at this moment, and the HLA-B51 was still awaited. So we treated him with systemic steroids, and with the systemic steroids, after 1 month, there was improvement. The vision had improved to 7.5, and there was some cells, but at this moment, his IOP has decreased, and HLA-B51 was found to be positive. So the diagnosis of this was the fundus photo and the OCT, which shows improvement. The diagnosis of Behçet's was made, but unfortunately the patient was a steroid responder, so he was treated with anti-glaucoma medications, and his IOP was controlled. Presently, the patient is doing well, and he started on immunosuppressants also. So the take-home message is that detailed medical history is crucial and can help identify potential underlying systemic conditions, and which can help guide the diagnostic investigations and influence the treatment. In our case, FFA and OCT was an essential tool which help us to diagnose a subclinical vasculitis, which was not seen clinically. So this plays an important role, and a good teamwork between the ophthalmologists, physicians, and rheumatologists is important in a case of uveitis. Thank you.
Very well presented, Dr. VINEET. Did you consider instead of oral steroids, Ozurdex at any point?
Not right
in the
now,
beginning?
The patient was
no,
young.
Now, of course, he's a steroid
patient
responder.
was young, ma'am, and also the lens was clear, and it was improving with the steroids, ma'am. So we didn't consider Ozurdex at that moment.
Because unilateral instead of giving oral steroids, especially during COVID time and all that,
yes,
that would have been an option.
Nice case, nice case. Also, this highlights that we need to be careful about the pressure, intraocular pressure, and other subspecialty apart from retina, though the patient presented with retina. Nice case. Thank you.